Patel, the very senior founder as well as patron of KQHDA. Sir, you please make it your own and uh, inaugurate the session with making a Shankanadam, sir.
Right. Thank you, President. Thank you.
Thank you, sir. Thank you. Thank you. I think we have started with the positive vibration of Omkara by making a Shankanadam. And this is one of the good exercises for the lungs as well as creating a positive aura in the atmosphere, which could able to bring a healthy and healing positive aura in the atmosphere as well as with us. Sir, thank you very much, sir. Now I would like to welcome you all. First of all, I would like to welcome today's the resource persons, Dr. Ajit Kulkarni and Dr. Lata Devarajan. And along with that, our patron and our chairman, Dr. Swami, and our ex-president, Srinivas Praveen Kumar, and others, and our Srinivas Sulu, and many seniors are here with us, Dr. Yaran Wahi, and so many persons of our, even our secretary or office bearers, everybody. If I take a name, I think it will take another half an hour. Let me say that each and everyone, you are on behalf of KQHDA, I would like to welcome you all for this national webinar. Now, not taking much time, I would like to introduce our resource persons today. Dr. Ajit Kulkarni, a well-known personality, a senior teacher, as well as a professor, an international speaker, and a director of Homeopathic Research Institute, Pune, a multi-talented personality, a veteran homeopath and academician, and a famed international teacher, a classical homeopathic physician practicing more than 30 years in Pune, and has given up to 2019 around 100 international seminars and workshops in different parts of the world. Give him a big hand. This is not an easy achievement. His century is already completed. And he is a co-author of Absolute Homeopathic Mathemedica, 5 regional repertories, AIDS, diabetic mellitus, thyroid, hypertension, and trauma. And he is author of Body Language and Homeopathy. The initially Dr. Ajit Kulkarni means many they used to talk like that a body language person who has identified in homeopathy something different from the routine. That the credit is with him. And the law of similars in medical science and homeopathic posology, Kali family and its relations, homeopathic covidoscope, body language, Deboli in Marathi language also, and more than 100 publications on various aspects of homeopathy. Many papers and books are translated in several languages. Even I'm not exclaiming, I know many other persons were written by Dr. Ajit Kulkarni, but in their name that books have been published. Sir, if I don't mistake me, as I am aware of that, I am telling. Dr. B. Sahani Memorial Award, and he has got many awards, the achievement awards. Naturally, the many personalities and the platform has recognized him, giving him awards like Award of Excellence in Homeopathy, Award of Homeo Ratna, Life Achievement Award, and he is a member, Editorial Board, National Journal of Homeopathy, Mumbai. He is practicing in Pune, established all over the world, his tentacles. There's great personality, Dr. Ajit Kulkarni with us. Sir, we are very happy to welcome you on behalf of KQHDA. And we have another personality with us today, Dr. Lata Devarajan, a silent worker. I will tell you, since I think 1994, if I remember, Dr. Patel, the repertory Patel was there. He asked her a question in that conference, are you a phosphorus? Whether madam remembers or no, I know. The same KQHDA national conference only. Yes. And she just smiled like this. Oh, now she is smiling. That is the personality she carried since then up till now. The silent observer and silent worker. She, when I asked her biodata, she was not ready to give. I said, okay, Lata Devarajan, that much is sufficient. So sincere and honest worker, academic coordinator, ML Davle, Medical Homeopathic Institute, creating modules and training interns and doctors in standardized clinical record. and this is coordinated in primary pilot study for slow learners in rural Bangalore for ML Davle Medical Homeopathic Research Institute. Is a research fellow for extramural research project for efficacy of homeopathy in scholastic difficulties for government children conducted by ML Davle Institute, the main branch of Ministry of Ayush project. And there are so many other projects are also there because up till that project completes, she is not ready to announce that. That is the honesty and sincerity of Dr. Lata Devarajan, and she has written many articles and presented her papers in the national and international conferences. Even she was a co-speaker in many seminars with me, I know. That's why I said she is a very silent and very keen observer, as well as I think a very good organizer also. Madam, we are very happy to welcome you for the KQHDA national webinar. And without wasting our time, I would like to give the platform to Dr. Ajit Kulkarni, sir. Sir, please, you can start.
Yeah, yeah. So at the outset, I thank the organizers, Dr. B.D. Patel, Dr. Sripad Hegde, Dr. Swami, and all the colleagues who are trying for the cause of homeopathy at a very difficult time the world is facing. It is altogether a big issue that you all are working hard every few weeks to promote the scientificity of homeopathy, giving the platform to many people. We have today some cases to present within a span of a 1 hour. So I have to give you the understanding today. Whether my slide is
You share, sir.
visible. Okay. Okay.
You share.
Yeah. Okay. Now this minimum prescriber, because I selected this subject because within a span of 1 hour, I would like to give you some cases. This all PowerPoint presentation is prepared by one senior homeopath from Israel, Dr. Daphna Lebanon. She used to ask me since 2004,
Sir,
when it was an
you start sharing,
international
sir.
debut for me. Yes, please mute yourself. Listen to me. Okay. So Daphna Lebanon used to ask me a lot of questions, a lot of cases and my guidance. And I didn't know that she collected all my jottings, all my advices, and prepared a PowerPoint presentation. And in one of the seminars at Israel, she presented this PowerPoint presentation. So today, the PowerPoint presentation is from Daphna Lebanon with my guidance. This is a unique experience for the homeopaths of India that they don't write anything but just go ahead what happens with the patients. So I will make a big screen. Okay. Yeah. Now this is the first case of a threatened mastocytitis.
Excuse me, sir. We are not able to see your screen. The screen sharing is not happening.
Not happened.
Yes.
Oh.
Yeah, please share. That's why I said she's asking.
Now is it possible or not yet?
Not yet, sir.
Why it is not getting shared? So can you guide me? What is the problem?
So you can just click on share screen again because I've made you the co-host also. So
Yes, yes.
yeah.
I shared, but nothing is coming out. I think you have to cancel my co-host.
Okay,
It is better.
let
Yeah.
me do that. So 1 minute. Done, sir. Now try.
Okay, now I will share the screen. Yes, now is it visible to you?
Not yet, sir.
No.
Not yet, sir. Sir, do one thing, sir. You just quit and re-enter, sir.
Okay, so
Me.
should I quit
Not
everything?
required. Not required. No.
Should I quit everything?
No.
You see, I will go. Okay, I will go with
No. Don't quit, sir. Share screen.
yes.
Yeah, yeah. See, your system is see now.
I shared the screen. Yes.
Okay.
Now,
In your system, what the things you have kept open,
1 second.
on that,
Sir, host is enabled to
let me share.
share the screen to all the participants.
Sir, in the beginning, what option did you click, sir? Because that time it worked.
Oh, when it
Yeah.
was not the co-host, you see.
Yes.
No. Cost has nothing to do with that, sir.
Okay. So what is the wrong? Should I? Because there are three, you see, basic, advanced, and files. When I go with the share screen,
No. Once you click on share screen, sir, the screen that is visible on your laptop or desktop, it will pop up.
yeah, but it is not getting. देखिए लागत नाही आहे स्क्रीन लागत नाही आहे ते म्हणतात बरं शेअर स्क्रीन केलं मी पण हे येतच नाही आहे आता शेअर म्हणू का खाली एव्हरीथिंग इज क्लिअर
Oh, yes, sir. Yes, sir.
Yeah.
Yes, sir.
सो आय एम ऑल्सो विजिबल
Absolutely. Sir.
You are also visible.
okay very nice sorry for the disturbance okay so I want to present you the first case of threatened mastocytosis a child of 9 months old treated with antimonium tartoricum and arnica for the last 2 days by Daphna for the catarrhal cough and the fever. Still, there is a white, thick nasal discharge. He suddenly had sticking out left ear, and the ENT specialist diagnosed as threatened mastocytosis. A pediatric doctor prescribed antibiotics. I said that if within 2 days there is no improvement, surgery may be needed. Daphna wrote me her observations mild swelling and redness, pain, low fever, no perspiration. You have to read between the lines. No fever, no perspiration. Child is not happy, moaning, crying, not smiling, and wanting to play. Dr. Adis was consulted on phone. He started thinking, okay, acute mastocytosis may be in the developing process. There is no fever. The thinking. I recommended Kali Mulaticum 30. 5 times every day for 4 days and keep in mind capsicum. Clinically, you know very well capsicum is a remedy of mastocytosis. Kali Mulaticum was given and let us see the result. Follow. Within 48 hours, mood better, started to eat a bit, no fever. The boy has started playing well, calmness, no moaning, smiling, crowding around, but very thirsty. She slept well. The ear is still sticking out. The ear is not sensitive and not sore. She is letting the mother touch it, which was difficult. Second day follow up, 50% improvement, no surgery needed. Third day, child is playing, sleeping well, a bit redness still present but better, and there is a mild catarrh and the cough. So she asked me the question in the seminar at Israel, why did I select Calimulaticum? Calimulaticum has affinity for the epithelium of throat, eustachian tube, and middle ear. What is the monogram of the Calimulaticum? Congestive, inflammatory, catarrhal, and the white. The second stage catarrh, you know very well, is covered by kali mutaticum. The first stage, ferrum phosphoricum. Vermeulen writes, it certainly is of great value in catarrhal affections, threaten mastoid. Nose, catarrh, discharge white and thick. Suzler writes in his own way, when the cells of the epidermis lose molecules of kali mutaticum, the fibrin comes to the surface as a whole or white gray mass. When dried, this forms a mealy covering. If the irritation has seized upon the tissues under the epidermis, then fibrin and serum are exuded. Similar process may take place in and below the epithelial cells. Mind well, this explanation also fits in well with the catarrhal stage of the COVID-19. My friend Dr. Sarkar, Sunirmal Sarkar, treated more than 100 cases of first stage of COVID-19 with kali mutaticum. And you know S receptors and the epithelium and how the entry of the coronavirus with its spike, all the proteins are being entering into the human system. There is one more thing with the Kali family in general, that is no fever or little fever. In the proving with Kali remedies, most of the Kali remedies don't have the fever. So you get the inflammation, you get the acuity, but you don't get the fever. Fever high grade, fever intense is almost absent in Kali family remedies, like Kalkera remedies also. As far as the Kali arsenicosum is concerned, you will find there is a fever, but it is mostly due to arsenic being attached to the potassium. So, a remedy like Kali muriaticum averted the surgery of a threatened mastoid given at the right time. A remedy is a remedy, but whether we give the remedy at the right time is very important. So, in a way, every disease, every clinical condition has evolution, the stages, the transitions. The same is applied to homeopathic remedies also. Gelsemium falls short of the toxicity in typhoid. Then it is followed by remedies like bacteria. Bryonia is often followed by bacteria, according to many authors' experience in enteric fever, because that kind of the toxicity you don't get in bryonia, although bryonia has meningitis. Solanum niger is between belladonna and zincum, between bryonia and helleborus. What exactly is this intermingling stage? Could we make a therapeutics on the basis of the clinical stages, which are a part of the natural evolution of a disease? So our remedies do possess these stages also. Matera Medica study is not only listing of symptoms. Behind the symptom, there is a system. There is a language of the system. There is a stage, there is a transition. And we must be convergent with this idea that a remedy at the right juncture, at the right time, at the right stage is the minimum, not only quantitative coverage of the remedy. So this gave me a lot of new insights into understanding the relationship of the remedies, which I tried to explain with my teacher, Dr. Tarkas, in Absolute Homeopathic Matera Medica. Because we want to understand what exactly is the language of the system. This is a second case now, neonatal jaundice. Daphna writes that she asked Dr. Ajit Kulkarni through the mail about the child of my nephew, 8 days old, with severe jaundice which developed on fourth day. After fourth day, you see, it is a physiological jaundice, not very serious. The infant was very lethargic and sleepy, and bilirubin was, yes, 14 higher. In my repertoire for infantile jaundice, I have 47 remedies. Daphna is working over the project of repertory since a very long time. She is a part of the complete repertory. She is a part of the Israeli Homeopathic Association, and I have been working with this organization too. And we are contributing many new rubrics also. So you will find a host of remedies. In a short time, I received Dr. Kulkarni's answer. Put the child China 30 three times for 3 days. So she asked me a question, why China? This is the answer. Babies have a high number of red blood cells in their blood, which are broken down and replaced frequently. Also, a newborn baby's liver is not fully developed. So, it's less effective at removing the bilirubin from the blood. Duration. In breastfed babies, it is common for jaundice to last 1 month or occasionally longer. In formula fed babies, most jaundice goes away by 2 weeks. So we are confronted with a case where we have to show the result. If the result is after 2 weeks, then it is not rapid in the language of Hahnemann. Physiological jaundice in healthy babies usually sees bilirubin levels at about 5 to 6 milligram to blood dilution on day 4 after birth, then dropping over the next week until reaching normal levels. Typically, bilirubin levels fall somewhere between zero point 0.3 and 1.2 milligrams per deciliter. Anything about 1.2 milligram per deciliter is usually considered high. We have here 14. Why China? It has an affinity for blood circulation and liver. Now listen to toxicology. How toxicology can be a very good aid for a homeopath to prescribe in pathological cases. Most of the pathological data in our materia medica is extrapolated from toxicology. So study of toxicology is a major contribution, and today we are more trying to understand materia medica through symptoms. So we have to combine all features, all ways, all avenues to study the materia medica. Destruction of RB cells, red blood cells, occurs due to China, due to chloroquine. Acute hypersensitivity reactions to quinine develops hepatic involvement. So what you have with the quinine, what you have with the China in crude form, the destruction of the red blood cells and hepatic involvement of the toxicology. So these are the major contributions to understand why China becomes one of the remedies in infantile jaundice when you have no symptoms, because child doesn't give you the symptoms. Painful numbness of the arm, third case now. This is the case of Daphna's husband. He developed a painful numb arm of left side since the last 1 week. So lot of causes, cervical spondylosis. Then you will find the causes related to neurology, carpal tunnel syndrome, a lot of things. I would like to ask you about my husband. He had for a long time numbness in his hands when sleeping, especially when sleeping on the side. It is a painful numbness. Now it is much worse. So, what is the totality here? If we read between the lines, since the last 1 week, there is a suffering, constant suffering. Numbness of the hands is when sleeping, and when sleeping on the side, maybe left side or right side, either sides. Painful numbness. So numbness is associated with the pains. There is a rubric, numbness, pain with. And it is much worse. The world is much worse. So the disease is having a pattern of response which is progressive. I have formulated the data processing through my article on 20 points recipe of data processing. You will get this article of mine on hpathy.com, and it will be a part of my second volume on homeopathy through harmony and totality. Here, several ways of patterns of the system are being represented with linkage to materia medica and the repertory. So here the pattern of response is progressive. So the pain, the numbness is all day and night. He cannot close his fist and lift the things. He feels like streams of pain there. He gained through the years some weight and a big abdomen, and I see recently that though he walks every day, his movements are heavy and he sighs a lot. These are just concomitants with the complaint of 1 week. Whether to give these concomitants of chronic type importance today is a matter of contention. In homeopathy, matter of contention is always there, and we have to see how a beautiful integration of the totality through all the symptoms together, past and present, because present may be the culmination of the past. And given the structure of the indivisibility of a human being, there is nothing like past and present. Past can be continued as a present, and the future is progressive. So time dimension has to be understood at various levels of its operation. And this is the contribution of Hanuman, no? After 12 years of efforts, he found that yes, there are some cases which fail because something in the past has to do something with the present through the separation. More the pains, more the mourning.
Единственный работающий здесь этот сломался.
So there is a mourning. Yes.
Ну вот.
Please mute yourself. Listen to me. So I replied, it may be carpal tunnel, it may be cervical spondylosis, and we have to see the radiculopathy, X-ray of the cervical spine is necessary, and then I gave a prescription that is plumbum metallicum 30 3 times every day for 5 days in order to see whether the pains are better. I don't know the details of the chronic constitutional remedy. Then he became my patient. Now he's much better with his constitutional remedy. But at that time, plumbum metallicum was given. So I was asked this question: why plumbum? What is the result with plumbum after 3 days? I'm happy to report to you that my husband is 90% better with the pain and the numbness. So she didn't wait for 5 days, wrote me on the third day. Much better. Acute remedy. People say that plumbum acts slowly. Everything is slow. Everything is heavy. In my relationship on plumbum metallicum, I wrote syphilitic calcarea. The torpidity, the indolence of calcarea, when it becomes syphilitic, it is plumbum metallicum. And lead toxicity causes indolence. The brain cannot work properly. There is a low comprehension. Everything becomes slow. Sluggishness of functions like carbonium sulfuratum, like gelsium, like causticum, which are rehearsals of each other, counterparts of each other in the relationships. Why plumbum metallicum? Let us see. There are four very important rubrics which I selected. Generalities, pain, numbness with. Generalities left. Mind, sign. Mind, pain, aggravates. And here, with these rubrics, plumbum is for high marks. So plumbum did a very wonderful job. But I have to work. I had to see the repertory. I have to write down every rubric. And my method in acute cases is to make the rubrics of all the symptoms together. First, I do quantitative analysis, then qualitative analysis. So clip number 1 of my repertory sheet is with all the symptoms together in acute. So I have a big entry now. I have a big exposure to the remedies. The second clip, I make characteristics separate. Then I combine all these studies together. Then I go in the Mater America. This way, I have found my success rate with acute increases very well. I used to not do this. I used to just focus on the characteristic symptoms. And if they are less, problems. If they are change in the next follow-up, problems. In the first follow-up, you may get the characteristics. In the second one, no, because the system is dynamic of the human beings. It is prone to changeability. So we have to respect the changeability. And we have to find the ways how we can help our patient in the most similar way. This is the idea. The idea is that our all thinking processes, unless they become rational, unless they are focused at what is the need of the similarity and how I can be similar fitting to the patient's data, I can't work as a good homeopath. This is the idea. All other hypotheses and imagination, fantasies and greatness of the stalwarts, okay, they are there. But they cannot be supreme than a homeopathicity. Only similarity is supreme for me as a homeopath. All others are great, okay, very good. But I have to treat on the basis of similarity. Now, rupture of the placenta. This is a case of a pregnant woman, third month, that diagnosed with a rupture of the placenta. In the beginning, it was brown spots of blood. Now it is fresh red and quite profuse. Listen very carefully. Read carefully. Profuse, fresh, bright red. Patient is chilly and constantly drinking water. These are the concomitants. Third month. If your remedy is right, you can prevent the miscarriage. So she is asking transatlantic. And we have to help. If my remedy is right, okay, yes. So what to do now? These are all acute cases. You have to act soon. Distance doesn't matter. Your brain matters. So let us see. Daphna gave Sepia 30, 5 doses, 1 week back, which helped her vomiting and severe indigestion and inability to eat and assimilate any food. So it did a very good work of morning sickness. On this level, she is fine. But now she has been diagnosed as a rupture of placenta. And the fetus is okay. So sonography report is very positive in terms of the fetus. But you know, if the rupture of the placenta continues, bleeding continues, there could be miscarriage. Daphna wrote some symptoms of chronic also. Okay, we have to respect them. They are to be mixed with the acute totality or not is a serious concern for a homeopath. In my acute prescribing challenges and solutions article, I have written how many dimensions are available as far as the treatment of the acute are concerned. Some people say that there is nothing like acute and chronic. They are part and parcel of the dynamic entity. Yes, okay. Sometimes it is wrong to intermingle chronic totality also. If the acute is explicitly clear, if the acute is a different totality, given the acute energy of the system, given the deviant deranged vital force representing a different symptomatology from the chronic, different symptoms, different modalities, different concomitants, different even causations, then you have to respect the different energy. Here, you should focus on the acute totality and give the remedy based on that. And if you try to intermingle chronic one with the acute one, it is wrong in some cases. So every data, every evolving data is a learning for a homeopath. How the symptoms move, how they approach us, what is the direction of them, how the miasmatic energy causes a lot of changes in the system so that the system represents at a different level. These are all the matters always to be kept in mind, and our vigilance, what is happening, is the only guide for a homeopath. Apart from the vigilance, apart from your knowledge, you also require, remember, intuition. Intuition is not just a gift of God. It comes only after knowledge, only after deep thinking and study of Mathematics and the repertoire and the cases and everything. Because intuition is a facet of knowledge. It just comes as a awareness. We are already conscious. Consciousness is a part of us because we are dynamic beings with consciousness. But sometimes we have to be aware. So awareness is an acute, active consciousness. And this acute and active consciousness, that is awareness, is a part of the homeopath's observation. Homeopath's how his memory comes as a flash before him. That is the state of the intuition. Don't think that intuition is something superstitious. It is not a you see useless activity. Never. But you have to check whether the intuition given to you at that particular time is really rational. So look in Materia Medica and repertory. Don't feel shy to look into repertory and Materia Medica before your patient. He likes it. He likes you to study. He likes time being given to him because no other science doctors give the time. It is only homeopath who gives the time. So a lot of drinks, arguing with her mother, and a lot of anger feelings towards her. She feels she needs her attention and affection and she doesn't receive. Also dreams of snakes. So what we are able to see is anger against mother. The internally she feels that she needs attention because she feels that she doesn't receive attention. You know, the cross reference to the rubric attention seeking is, you see, the feeling of being abandoned, forsaken, slighted, neglected, repudiated, isolated. Why there is a need of company for pulsatilla? Because there is a severe abandoned feeling. So this feeling which is at the base is alleviated, diluted with the company of any kind, maybe a child or maybe an old man. That is pulsatilla. Because she has a device of company to engage with the company, which is capable to reduce the abandoned feeling. That device is not available with magnesium. Magnesium feels the internal, you see, feeling of being isolated, orphan feeling, but there is a communication block. I cannot communicate with you in a free way because of introversion, because of the conscious opening being blocked. So the subconscious field of the dreams is open up. So the remedy could have the end result the same, but the phenomenon is different. In this phenomenon also there is a remedy. And this is the beauty of the Mother America. And when you know the phenomenon, when you know the origin and the time of consultation data together as a one spectrum, that spectrum is totality. So the concept of totality is inclusive of cause and effect merged together. Not only cause, not only effect. No, it is one phenomenon, one spectrum, one string. Just you see how it developed and brought to the present status in acute, subacute, and also in chronic. So we have now a very important case. Now let us see. I advise a single dose of phosphorus 30, no repetition, because it is already diagnosed rupture of placenta. Repetition more is not good. I told Daphna to ring me 3 times every day until the bleeding stops. Just give one dose and let us see what happens. If need be, I am ready to repeat. This is called as a repetition to the point of reaction. There are many ways of repetition in homeopathy. Don't harbor the concept that repetition is bad. Or I am a classical homeopath, I don't repeat. If the patient needs a remedy, needs a repetition, repeat it. If the patient doesn't need repetition, don't repeat it. This is the science. The science doesn't say that repeat or not repeat. It is the patient's data which decides when to repeat and not repeat. This is the science. This is the fundamental principles of posology. Unfortunately, still today, we are guided by 5th edition of Hanuman and less by 6th edition of Hanuman. In this case, she is in a delicate situation. More repetition means more bleeding. Rupture will be more. So let us see what happens now. My thinking process. Rupture of the placenta is a tubercular miasmatic going definitely towards syphilitic miasm. And see what happened with a single dose of phosphorus. I gave one dose of phosphorus 30. Within one day, the bleeding stopped. Pregnancy continued very well. Let us see now. One more case now. Dental operation. You see, in clinical practice, we always say that yes, I gave a remedy on the basis of the totality, but it didn't work. So we have to find why it didn't work. The remedy could be really well indicated, but miasmatically less indicated. So remedies one must cover the patterns of the responses, whether it is rapid, whether it is gradual, whether it is slow then rapid, whether it is rapid then slow, whether it is status quo. In which miasmatic activity the system lies today, and in which miasmatic You see, evolution, it is marching ahead. All these are the matters of the study. So when you have the totality, you have to include all these points to make up a totality more appealing to you. More, you see, making refine for the sake of administration of the remedy on the basis of similarity. So similarity is not only symptom coverage. Similarity must be at the level of everything possible, but the essence must get covered. This is the idea. So we have dental operation. It was a short but very useful advice that Dr. Kulkarni gave. It was about my patient that went through dental operation of root canal and extraction of the tooth. He used to suffer from gnawing in the affected for months together. It was worse by touch, but didn't approach the dentist. Mild pain, worse by touch, worse by masticating. After the procedure, I gave her arnica montana, which helped the pain and the trauma. Yes. The dentist diagnosed dry socket where the blood is not clotted properly over the surgery, so the bone is exposed. This is what the dentist says. It has a meaning. Patient was in pain, anxious, and nervous. Wants to lie down in bed since the pains. So, what is the totality? I asked the question. How is the patient? Oh, he is lying down in bed. Doesn't want to move with the pains. Touch aggravation is there. I thought of one of the remedies that related to the bleeding after tooth extraction. Because there is a bleeding, because arnica has been given. So I want to give a remedy because there is a you see blood not clotted properly. Bone is exposed. Yeah. What to do now? Plantago, Hecla lava, Calcula fluoricum, hypericum. Blood is not clotted lachesis, Crotalus solidus, vipera. Bone is exposed. You see, remedies acting on the bone, Calcarea fast is a very good remedy. See, a lot of remedies do come in the mind. They must come. More the remedies coming in your mind, you are a good homeopath. Your memory is very good. Now the next work is there. Open the repertory, open the Mater Medica, read each one, read pathogenetic action. Try to see how it is of use. Yes. So I thought, let us give a remedy along with biochemical usage. Calcarea fast and Calcarea fluor, two biochemical remedies along with the indicated remedy. Then I thought, is it really necessary? So let us see what I did. I look into the repertory of boric, mouth gums bleeding protractedly after tooth extraction. There are 6 remedies. Protracted means running for a long time. Protracted menses. Arsenic bovista, hamemilic, cruozot, phosphorus, trillium. I almost gave hamamelis, but I decided to ask Dr. Kulkarni's opinion. So let us see what Ajit Kulkarni advised. Staphysagaria 30C. Let us see now Staphysagaria. The result with Staphysagaria 33 times for 2 days. The patient reported of taking stitches out, no more pain, everything is fine. I'm delighted to tell you that my wound has healed very well. There is no bleeding. Now let us see the reasons of Staphysagaria. Injuries, stretching, lacerations, cuts, incisions, surgical. C. Mechanical injuries from sharp instruments. All the instruments of a dentist are always sharp. Extraction of the teeth, which is an important causation for staphysagrия. Elements from being wounded. When you do root canal, when you do any surgery, small or big, you wound the system. You know, removal of the organ has been called as a mortification in surgery book. So what is the difference between indignation and mortification? And you will find in staphysagrия, both are regarded as the causes. My friend Dr. Bipin Jain wrote a very good book on staphysagrия. ICR, Lataji knows it very well. He used to call staphysagrия as a hero. Why hero? Because he doesn't want to become hero. He always wants to say that, yes, I am a man of pride. His haughtiness, his conceited behavior. He wants to show to the people, yes, I am a man of heroship. That is the thinking with staphysagrия. And the sensitive and vulnerable pride. So when you do any surgery, especially removal of the organ, it is nothing but tantamount to death. So in indignation, the dignity of a person is involved. Indignation, my image, my prestige, my ego, my self-esteem, don't wound it. This is my treasure, and I would like to keep up this treasure. But behind this treasure concept, there is a fragility of the ego, fragility of the pride, vulnerability, delicacy. So the staphysagrия is much more offended very easily. Do you know staphysagrия is like pulsatilla also being submissive? Both are in the repertory under the rubric submissive, 3 marks. The cross reference to the submissiveness is yielding. Complete repertory gives 72 remedies for yielding. Staphysagrия is there like pulsatilla. So why staphysagrия is there? We have only one image of staphysagrия. No? Dr. Philippe Belle gave 4 very good images of staphysagrия in his homeopathic psychology. So what is the thinking process? There is a sweet staphysagrия. There is a wild staphysagrия, grossly. So in the sweet staphysagrία, he wants to maintain his human character, which is noble, which is very good, which is very nice. I am very nice with you, but you must be nice with me also. It should be mutual. So I am respecting you, and you, if you don't respect me, this is wounded, this is offended. And so what is mortification? It would have been better on my part to embrace the death than to tolerate this offense, than to tolerate this indignation. So in the mortification, you just want to go with the process of the mind as far as the death is concerned. It is too severe. This is very deep. So mortification as a cause is also part of staphysagrία, which exactly happens when you cut gallbladder, when you cut the organs in the body. So in those cases where the organ is cut, I often give staphysagrία. And if there are multiple cuts, multiple surgeries, don't forget a very promising remedy, streptococcinum. It is not only for tonsillectomy, for multiple surgeries. Dr. Margaret Tyler used to call streptococcinum as a mighty remedy. Mighty means very powerful remedy, WWF. Some author has written, it is a, you see, blend of phosphorus and solinum to deeper acting remedies blend together in streptococcina. So you have morbidly sensitive hurts very much worse by touch. What was the entry point for me to give Staphysagra in this case? First, these mechanical injuries from sharp instruments, extraction of the teeth are the cause. And the second one, touch aggravation. Touch aggravation mentally and physically is very typical of Staphysagria. In my body language book, there is a chapter, tactile communication. How touch has a very important role to play for a homeopath. When the patient sits before you, have you observed this? I had a very interesting case from Europe, and the lady was very, libertinistic, free, and she had the habit to touch the people. So when I was taking her history, she tried to touch my hand. I was just back. Touch is a direct communication. When to touch, how to touch, how long to touch, where to touch, what is the time of touching. All these matters great in tactile communication. Touchy. What is touchy? Oh, his mind is very touchy. What is this? Sensitive to reprimands, sensitive to comments by the others, sensitive to criticism, offended very easily, constantly inclined to lie down. Do you know this is a classical symptom of Staphysagria? Read Staphysagria carefully. Constantly inclined to lie down. What is the thinking process? How I was offended. It's like manganum aceticum. Manganum aceticum patient feels better with both mental and physical symptoms, wants to lie down, and lying ameliorates cough, bronchial asthma, headache, and also mental depression. History of gnawing pain in the carious teeth. You know, caries is a rubric where Staphysagria is listed for 4 marks. Hemorrhage gums. Did you know this? Hemorrhage gums. So Staphysagria does cover bleeding. That is one of the entry points in this case also. Pain and nervousness after extraction of tooth. Generally it is wounds, bleeding, Staphysagria. So this is a new information which I started gathering after going through the rubrics. And this all study requires not much time. I will tell you, just sit within 10-15 minutes, you know everything. Just make a very good list of everything. Go on writing. Writing is a very good habit. Very good habit. Just write. And if your mind works very nicely, the hand and the brain coordinating very well, good homeopathy. You don't forget. Everything comes to you vividly, actively. About this particular case, I will tell you, Staphysagria was within few hours very useful to relieve the pain and the inflammation and bleeding and everything, to the amazement even of a dentist. I will tell you one very interesting case of a homeopath. He consulted me very long back, almost 25 years back, for some psychosomatic complaints, headache, tension headache, blood pressure he had in a very young age because his father had blood pressure.
Настюш, одеваемся.
And this particular homeopath was helped by Staphysagria because the most striking dispositional character of his personality was offended very easily. And he used to become very angry when someone used to make any comments over him. He had the habit to bottle up the anger, and then it was like a volcano, like an explosion. So I gave him Staphysagraphy for 25 years and it was hell. Then he was teaching some students in a college. And one day, 4 years back, one homeopath met me and told me, Sir, this homeopath, you know him, he is admitted in a hospital. Today is the 13th day he is in stomach comatose case. He sustained cerebral vascular accident and nothing is working. 13 days semi-comatose. I made the case, went in the hospital. I started asking the questions. What was the status? What he's going to do? What was his life within the span of so many years? And he discontinued hypotensive remedies of allopathy without informing anyone. Then he sustained brain stroke. So I asked, what was the cause that he, you see, didn't take the hypotensives? When he's a doctor, he knows that he cannot stop them abruptly. The answer was his anger. There was some, you see, function at home. Some relatives came, and one relative made a very harsh comment over him. He was very angry. It was about his health. And he became so angry that he told, I will not take hypotensive right from today because you spoke about my health. Very proud, sensitive pride and vulnerability. And then within a span of 5 to 6 days, he had the attack. Now, I wanted to give a remedy now. There was a hematoma which was operated upon on the fourth day. There was some leak of the hemorrhage in the brain, but no other symptoms. How to select a remedy? Arnica was already given. Someone gave, you see, Calcarea carbonicum. I didn't understand why it was given. Someone gave Natrum muriaticum because of his nature. So I was thinking how I can help this homeopath. 13 days of semi-comatose condition. Tell me, after he discontinued hypotensive remedies, how he was behaving at home? Very simple question. And wife started telling me, very difficult to pull on with him, very angry, abusive, throwing things away, quarrelsome, didn't want to eat. We have to request him to eat, and he will just throw the thali. The attack came when he was agitated. One remark by someone on the health, very sensitive pride, abrupt stopping of the hypotensives, the attack. And this is the state. I wanted to give now, why not Staphysagraphy? The remedy which helped him 25 years back, why it will not help? Let us try for this remedy. I went to study the remedy. Complete repertory, boric repertory, synthesis, many other repertories don't give hemorrhage in the brain under Staphysagraphy. we open Dr. Tarkar's unpublished work on repertory. Dr. Tarkas started working over the project of repertory and materia medica since 1945. Most of us didn't have a birth. So under the hemorrhage brain, 1 mark, there was staphylococcus. So it covers the cause, it covers the behavior, it covers the bleeding. So I thought, let us begin with staphylococcus. Let us see the movement that occurs after staphylococcus. Then I will take the decision later on. For 2 days, only staphylococcus. Because of the pathology, I decided to go 30 potency every 3 hours. Because the system needs frequent stimuli to arouse the vitality and to come out of the state of being slumber, semi-comatose state. And believe on me, Staphylococcus 30 given every 3 hours. On the third day, he started moving himself. The fingers, the hands, the facial muscles, the eye muscles. And on the fifth day, he was awake. Staphylococcus was continuing in the same position. We didn't stop it. He fully recovered from the attack, although with some 10 to 20% hemiparalysis of the right side. Then he was given later on many other remedies with a lot of psychotherapy. So, what is the learning of this case of staphylococcus? Because every case gives you a lot of learning. The remedy staphylococcus, which you gave 25 years back, was on personality basis with some psychopathological behavior. The same remedy, staphylococcus, later on was evolved in a person in terms of the pathology, deep miasmatic syphilitic pathology. We always say, no, every polychromous remedy has all the 4 miasms, psora, psychosis, tubercle, and syphilitic. So remedy can be the same, though the dimensions of the miasmatic activity in the evolutionary process of the march of the disease can be changeable, can be at a different level of influence. And still the remedy could be the same. That is the learning of this particular case. So these are rewarding cases for a homeopath because they give you a better appraisal how to approach the cases in acute and chronic cases. Just take the effort, look into the and the repertory. Don't be shy of looking. Just hunter and hunter. A homeopath is one who is a best hunter and is a best slave of patient's data. So what are the qualities we need as a homeopath? First, a good hunter. Second, a good slave. You may not like this word, no? Let us stop this word. You must be surrendering to the patient's data. It is enough. Honest, authentic, accurate data. You just surrender 100%. And then you will find how homeopathy can be a therapeutical system of nature, very, very useful in all cases where the patient can be cured if he is in the curable stage, or palliative when cure is not possible. Okay, so this is all about today's presentation. I'm an author of many books. If you want the books, I will just give you within minutes. My posology book is over, so I'm coming down with a advanced edition of this. Kali family and its relations are published by IBPP, available. Body language and homeopathy not available in English at present because we are making some changes. However, if you want this book, because this new book will come at least, it will take more than 8 to 10 months. But if you want body language and homeopathy in English, I have a full, Xerox copy of the book, which could be given at a reasonable price.
We'll translate into Kannada, sir.
Very nice, because it is already translated, and I have to give you only yesterday. This my book has come up in Marathi language,
So good, very good.
and it has been now published very well, hardbound, and almost within 2 days, more than 100 copies of them sold out at Pune. But here we gave only body language, because this was mostly useful for all kind of the people, of all professionals and doctors and advocates and judges and everyone.
Yeah, yeah.
So
Thank
this
you.
is a very good idea, and I appreciate Dr. Sripad for being ready to present this book in Kannada language.
Yeah,
One
yeah,
of my guru's book has been translated in Kannada language. My
yeah,
spiritual guru, he wrote a autobiography during 1975. I published this in 1991, and this is the book which I was able to get it published in Kannada. So if this
yeah.
book is published, it is a mutual happiness for me. And Sripad, whatever help you need, I will be the most happy person to render
Positively,
you
I think
this
we
one.
will discuss sometime about that, how
Yeah,
that we can
yeah.
coordinate and bring it to
Yeah,
life.
yeah.
Thank you very much, Dr. Ajit Kulkarni, sir, and it was really very enriching and a learning session. I think explained well and accepted